My talk is what I thought of before. So if we have a day like today looking at all the science, what would we need? And what are the tools we need to pursue a comprehensive strategy? So this is very familiar to all of you. You've seen the middle of that already today. And our comprehensive strategy seeks to arrest all the routes of transmission in that whole complex piece of epidemiology. So with apologies to Gareth, where Gareth has gone, we're back to the science, but actually part of interfering with all of these modes of transmission, of course, is people and the way people behave. So looking at that, and I'm not going to read through it all, you have to arrest all of those routes of transmission, and every single one is important. Cattle to cattle is crucial. We spend a lot of time on cattle to cattle. Cattle to badger is important, very well illustrated by Rosie. Badger to cattle, of course, and badger to badger is sitting there as quite an unknown, but it is a consequence of the whole of the epidemiology. One way or the other, it's part of the whole picture. So we're looking to deal with it all. What I want to do is just run through some of the key things, and I think we've covered almost all of them during the day. This slide then is just an illustration of what we know, and we've seen this twice already, I think, from both Christl and Rosie, because it's very relevant work, is the relevance of badgers in the epidemiology and cattle in the epidemiology. And I use it without the central estimates, without the average or the best estimate. I'm using only the ranges, because the truth lies in those ranges, but actually there's a lot of uncertainty. What is certain is that cattle to cattle transmission is crucially important, but so is badger to cattle transmission. If we don't deal with both, we won't eradicate the disease. So even if badgers only directly cause about 1% of the transmission events, once you amplify that through the cattle challenge, we won't manage to bring the disease down to officially free status, never mind elimination. And I think complete elimination of this disease is something we're not going to achieve. So it illustrates the uncertainty we have to deal with, but we have to deal despite the uncertainty. But the science we've been talking about starts to eliminate some of the uncertainty, or starts to tell you where you can reasonably act, and we have to act in reasonable ways. So for each aspect, I want to look at where we are now, think about what a perfect solution might look like, and look ahead to what we can expect in the near future. And I'm quite encouraged by today, because my near future look ahead doesn't cover all of the things we've been discussing today. So there is a longer term contribution that we can have, whether again that is the natural sciences and what they offer, tests, whatever, or the way we change people's behaviour and the way we're able to tip the balance in the way this whole complex disease works. So cattle diagnostics, what we've got, skin test, the gamma test, we've heard about it today. What we would like, something highly specific and sensitive, both of them at very high levels. Cheap, little scope for error, only requires one visit, doesn't require vets and their technical colleagues to have their hands trapped in crushes, and has international recognition. So it's the fantastic test that we don't have. We're looking for close to 100% on both specificity and sensitivity, and it's on the latter that we fall down so badly and leaves us with a big problem. What can we anticipate in the short to medium term? I'm talking for England, but it's happening elsewhere. Greater use of the gamma test. The gamma is not so specific. You bear a cost when you apply that test. You'll take out more cattle to try to get at the residual infection in herds, but we will use it more. It's the tool that we've currently got to do that. More testing, consulting on a simplified testing regime as we are now. The high-risk area possibly in England being tested every 6 months. Recognising that we're doing close to that in many areas anyway, we're just not doing it in a systematic every 6 month way. But in terms of research, Glyn touched on this, pursuing a DIVA to help with vaccination is actually producing us possibly a better test already. So a better defined antigen test may give us a better tool, which is in prospect. And then earlier on today, we heard of rather more distant possibilities for better tests, and we should embrace those as we get beyond the stage of proof of principle towards making them truly usable. So this is the test we've got at the moment, and it's a challenging test. So you've got not only the science of this test, but also how hard it is to do and the challenges of doing it. So it would be nice to move away from that. Cattle vaccination I won't dwell on. Glyn has covered it very well. That point about it's always 10 years away, that is so true. It's very difficult. Not only have we got to have a test that works, it's got to work sufficiently well enough, it gives us enough value that we can deploy it, and it will be accepted. It will be seen to be a useful part of our strategy, and we're not there yet. So the next stage is producing something that allows you to tell whether an animal is vaccinated or not. But beyond that, will the vaccine be tolerably good enough actually to turn around TB in the cattle herd at a cattle herd level? So it's a big challenge. So these animals, can we protect them? If we do protect them, can we test them? And so on. Cattle genetics we haven't covered today. I've included it because it's just another part of the picture. It produces a marginal benefit. But this is all about numbers. We're trying to turn the number. So we haven't dwelt much on the reproductive rate. But getting this epidemic to drop behind every single infected animal infects one more, especially, as James said, when you're doing with a composite, not only just cattle to cattle, but also a feed-in from badgers, everything we can do that edges it below 1 and tips the point on epidemic is worth having. So genetics, these are marginal effects, but we're talking about big numbers, and it's already been embraced. So this is a real TB sire selection chart to allow you to see your TB advantage. Currently available for Holsteins, may be available for more dairy cattle, be longer to come for beef herds, but it gives a marginal advantage. Risk-based trading. Amy has talked very well about risk-based trading, and so has Gareth. I think this is really the one where you have to win hearts and minds. The government has embarked on a voluntary approach. I'm really glad it's part of checks. It's done in a very simple, easy to understand way. We need to see people embracing that so they don't take risks that they don't need to take. I'm quite struck by the fact that we focus on the risk to herds in the low risk area, but as we heard earlier, there are long-term free herds in the high risk area, and quite a lot of them, where there's everything to lose if you don't pay attention to the risks you take when you trade. So this is a real prize and one really worth going for, and I hope we can manage it on a voluntary basis. This is something we're doing which allows people to see where TB occurs. So ITB shows the location of individual herd breakdowns. Anybody can look at it. You can look at the area and see where TB is pretty much in real time. So you can see your geographic risk, but you can also see risk in areas that you're trading from. So giving people information increasingly and giving them reasons to act on it. On-farm transmission, a huge area. All day we've talked about the unknowns in the epidemiology of TB. We need to throw a lot of effort at a more complete understanding of the relative importance of different routes of transmission, clearly understanding the importance of herds that are cleared from TB apparently and still aren't clear, and what risks they pose and how we deal with that. Also unpicking better how that interaction between badgers and cattle happens and what's the relative importance and the relative proportion. One of the key things that's coming along, so Lord Krebs spoke earlier about looking to use genomic analysis to better understand what's happening with TB epidemiology. Well, our old technology, spelliger typing, is now shortly to become history, because now we have whole genome analysis. And as we bring that on board, we'll have a better tool to look at what's happening at a molecular level. On the other hand, we have an asset. Every time we have a herd breakdown, we go and look at the herd, we talk to the farmer, we try to find out what all the risk factors are and try to establish that key question: why do some herds in a high-risk area go down and other herds don't? And when they've gone down, can we understand why they've gone down? So effort in here to get at this knowledge is real old-style epidemiology, which we need to follow through on, and we are currently strengthening. So how does it happen, and how do we reduce it? And I'm afraid this is a badger focus, but it shouldn't be. It's all of those routes of transmission. Badger vaccination, we've talked a lot about badger vaccination. It is such a prize. Nobody wants the long-term solution to be culling in perpetuity, maintaining a low population of badgers forever. Getting at vaccination is really important. Really great to see the example from Ireland. I hope that translates very effectively into the practical next steps. So very worth going for. As we've heard, real challenges, not only in whether oral bait vaccines can be made effective, so it's easy, but also will they be protective enough, and can we afford them? Because if you have to have a high payload vaccine, we can't probably afford to distribute it. So that work is really important, but not setting aside the potential value for injectable vaccine if you can do it in an affordable way. And again, we have probably something to learn from Ireland here. And you've heard about the potential future. I love the idea that it has to have a label, so you put it in an envelope and then post it into a badger set, but that will keep us compliant and hopefully not put off the badgers. So badger culling, I think we are where we are in England with regret, not because this is where we want to be, but it is proven that there is evidence behind a strategy. We've heard earlier that it's a strategy that works only at scale. It's not something in England you can sensibly deploy in a bitty way. So the government is committed to this policy and is looking to grow the area where culling can be carried out effectively to have an impact on disease in cattle. So in the short to medium term, we can expect continued rollout of culling across the high-risk area and potentially the edge area. And we will be looking for an effect in cattle, but there are very good reasons why there's a very long lag phase in terms of seeing that effect in cattle, and you've heard it during the day today. So in conclusion, this diagram, a strategy that strikes at all of the routes of transmission, all of the elements of that epidemiological diagram. And we need to continue to seek scientific advances to sponsor the research and be prepared to embrace them. But it is always a long haul from the principle, the new and emerging test, to actually being able to deploy it in the field. So what I've given you is the here and now, the short term, but what we've been hearing about today is potentially the longer term. And I'm really encouraged by the work that's going on. So thank you again for inviting me, and thanks for a great day.